So our main problem is that the oral health care is going down, and people are having more struggles to go for the dentist and to at least start the first diagnosis treatment or the first diagnosis appointment because of many reasons. One of them is for example, in Europe, we have very long queue, and this very long queue is because that we don't have enough workers. We don't have enough dentists in the hospitals or in the clinics. And that's also because that there is no enough budget for the salaries for new and more workers in the hospitals. So the patients, they have really long queue, and then they decided not to go because for example, you can have appointment after like 3 months or 4 months, and then sometimes happen that the problem that you have increased, and not only increase, it goes, for example, a tooth will be broken, so it become really big problem. So all of the oral health care is going down because of these struggles. Second thing, even if they got an appointment, for example, after 3 months or something, it's not cheap at all. It's very expensive. Plus the addition payments and addition bills for the treatment itself. So with HammTek, what we do is we are trying to save this first appointment at least. We are saving this very long queue. We are saving the worker shortage. We are saving money for the patients, and we are also saving the dentist time, because after the patient take videos with HammTek, then the dentist can have these videos to check them again and again, and check if there is any problem, and check the treatment plan if it's going right, if you want to change anything or so. So with HammTek, what we do is the patient doesn't have to wait for long queue. He just take videos with the device in his home. There is no trip. There is no struggles with going this whole trip. There is no expensive payments. For example, when we talk about the price, it's not only the first diagnosis appointment price. It's the price about the whole trip. But if someone has a car, he has to think about where to put the car, the petrol, and the parking. I mean, the whole trip it has a really big price at the end. And if someone doesn't have a car, he has to calculate the transportations and the time as well. So with HammTek, we don't have, the patient doesn't have to calculate all of these things. He doesn't have to feel all of these struggles. He just take videos inside his home, and then the videos are on the server, and then he choose whether to go for a dentist now. After he got the report will tell him that, okay, now you have a critical thing, and now you have a tooth that must be treated as soon as possible. Okay, now you have to just take appointment with a dentist from our dentist list. And if not, so he checked his teeth, and that was it. And he can check his teeth tons of times. For example, the HammTek is for 200 euro, and the dental checkup is for, let's say, 35 euro. But the device will be at your home, and you can check your teeth every day if you want. You can take videos every day if you want, and you can consult online dentist every day if you want. So there is a big difference. And also we do treat a really big problem that I have seen by myself inside the hospitals: the handicapped patients and the medically compromised patients. We do have patients who are completely having their days inside the hospitals, and they are moving on wheelchairs, and there is also some patients that are they are sleeping on the beds. And once they feel something in their teeth, okay, so they have to move from this part from the hospital to this part to go to the dentist, and this whole trip is very, very bad. Is it's it's very hectic. It has many drawbacks on the patient himself. It exposed the patient for more problems, because some patients, they have bacterial infections, so it exposed the patient and the dentist and the nurses, all of the stuff, and everybody he has met during his trip to the dentist side. uh, he exposed them to more complications or more infections. So it's very bad for these patients to move from their place to the dentist just for check what's going on, even if it was a big problem. Sometimes we have to extract one teeth, but the problem is we have to again consult his doctors to ask about the medications and everything. Is everything okay? Did he took the medications today? Does he have to take antibiotics, stuff like that? And then we plan for extraction for the next time, not in the same visit. So after all of this long trip, we don't do anything. Sometimes really we don't do anything. So it's a very big struggle. And that's why if these patients or these sectors in the hospitals use the HammTek device, it will be much more beneficial in all aspects. Another thing, the nursing homes, they do have struggles as well in their trip to the dentist, because they have to plan a whole system. They have to plan who is the nurse who will be accompanying the patient, when he will go, and how many patients per time, and is it a taxi, or what kind of transportation, what company we will deal with, and then what hospital we will deal with, and then they have to deal with all the papers and everything just for one time follow-up or something like that. And the one-time follow-up is not enough for elderly people who are living in the nursing homes, or for anybody. It's not enough. One-time follow-up is not enough per 3 months or 6 months. It must be every 6 months, but not what we have seen now. It's expanding. It's like one time per year or something like that. So this is not beneficial at all if patients are waiting for the queue, and if there is no enough workers because of the no enough budget.